Dr. Jorge Mo, I'd like to position this question for you. Not only are you a family physician, not only have you sat with a large national entity that's also a large lobby, you have also navigated health systems in Puerto Rico. Some of you who are joining us online are coming from Georgia, Florida, Puerto Rico, so we get a little bit of a window into what's happening in the world around us. Can you tell us how much change can you affect at the insurance level to answer these rural and urban issues with your type of position, not just as a clinician?
Well, one of the things I think that we have to do is that we have to be higher participants in voicing our concerns into the medical plans and making sure that we are working in a way that we are heard by the medical plans and the concerns of the people, and make sure that in that area we have a voice. And by saying that we have a voice, I think one of the things that we can do is that we can volunteer to become part of the committees into medical plans, or even work as a consultant in the medical plans and voice both the concerns in terms of what shall be done to our patients and what should be done to our providers. To that extent, I have encouraged family physicians in my community here in Puerto Rico to be members of the advisory board for Medicare, to be members of the differential committees of different plans in Puerto Rico, and to make sure that our voice is heard into these people, because sometimes their way of thinking is little different. So if you don't have the voice of a physician as part of the organization, they will miss also a lot of information and to advocate for our patients to us as providers.
Thank you, Dr. Mo. Oh, Dr. Peter Reeves, you'd like to add something, please.
I'd like to mention that there are fundamentals here that are at work that no one mentions. I believe it was President Clinton signed in 1992 a bill that eliminated the need for insurance companies to pay for a medical procedure or practice encounter that was both reasonable and reasonably priced. As of 1993, physicians, even if they cared for their patients, would not be paid by insurance companies by any requirement. So that basically, as of 1993, I would consider physicians to have become de facto employees of insurance companies. Until this is changed back and this conflict of interest goes away, which I don't see happening because no one's talking about it, we're not going to have a voice. If you look, I work in an organization for a large hospital corporation, and they have their own culture. They're not going to listen to community physicians. They have their own views of what physicians are like and what they do. There's no community physician input at all. And that's the biggest corporation. And it's hospital-based. It doesn't work unless the conflicts of interest are legislated out instead of what's been happening in the last 40 years. That's my view. Thank you.
No, an interesting point you mentioned, Dr. Reeves. So